Welcome back, everybody. Thanks for visiting. Today we're going to talk a little bit about unders and overs, and I'm sure a lot of ladies are familiar with that terminology, particularly ones who have been researching breast augmentations. What that pertains to is whether or not the implant is placed under the muscle or over the muscle. Now, try to get your head around this in terms of what that involves, okay? Now, you have to understand, firstly, when we're putting an implant in, okay, we rely on your own tissue, if you like, to cover this implant. You don't want to be able to see the outline of this implant, okay? If you have your enough breast tissue on your own, okay, and you just want a little bit more volume, okay, that usually tells you that you have enough breast tissue, or any tissue, in fact, to cover this implant. So you're not likely to see the outline of this implant. If, however, you're very, very thin and very trim and have very little to no breast tissue, your only option, in order to avoid seeing the outline of this implant, is to put this implant deeper. And so what we then do is we place it under the muscle. In other words, give an extra layer to cover the implant, because, as I said, you don't have much of your own breast tissue. Just to illustrate this a little bit better, I think it's easier for me to show you here. This is a very, very thin garment. As you can see, you can almost see my hand through it, okay? There you go. So if you're very, very trim and thin, and we put this implant underneath there, okay, you can actually see every little nook and cranny on this implant. Can you see that there? You can see the outline of the implant, and you can see the little folds underneath the implant as well. In order to avoid that, we have to place this implant deeper under the muscle. So we dig a little bit deeper, and we then put it under the muscle as well. And now if you put it under the muscle, you've got thicker tissue in front of the implant, you're not going to see all the little details on the implant like you could with a thin garment. So in other words, you add a little bit extra tissue involved. So therefore, it looks a bit more natural. The decision as to whether we go under or over is usually made by the surgeon, depending on how much tissue he feels you have. And of course, all surgeons are pretty clear with that once they examine you. I suppose it's not so much of a choice issue, particularly if you don't have much breast tissue to begin with. The only option will be to go under the muscle. So it's something that will be explained to you at the consultation. In terms of implication-wise, I think people need to understand when you go under the muscle, because it involves just a little bit more surgery, it can be a touch more painful, although with the more modern techniques, the tissue is much more gently separated, and so therefore the pain is much less than it used to be even 5 or 10 years ago. So in terms of your recovery-wise, I suppose that technically, because going under the muscle involves a little bit more dissection, a little bit more cutting of the tissues in order to actually make a pocket, it can be slightly more painful afterwards. Now, having said that, with the newer techniques that we're using and the new instrumentation, dissection is much smoother, and so therefore the trauma is much less for the patient, and so therefore hence the pain is also significantly reduced. So overall, that means that your recovery rates are probably not that much difference, talking about 1 or 2 days difference now, and most patients are actually able to go back to office-based work within 3 to 4 days. Things have moved on. Things are a lot more acceptable to patients now, and so they can get on and do the normal day-to-day things much better than they used to. Having said that, we do like to avoid any bouncing or any kind of sort of aggravated exercises that involve movement of the breast for about 4 to 5 weeks. But of course, we give you a full set of instructions and precisely what you can and can't do after the operation. With respect to our clinic here, we also offer our app, which you download, and that gives you sort of a day-by-day sort of instructions in terms of do's and don'ts, what you can and can't do, and that's quite helpful for a lot of patients, so they can know, when they can start exercising, when they can start walking around, all these things, or raising their arms up and down. So that's quite useful for many of our patients, and all patients are offered this.